us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so in our next series of videos for health in the Australian and global context, we are looking at groups that experience health inequities here in Australia. The syllabus requires that we look at 2 separate groups. And the first group that everybody must look at in New South Wales is Aboriginal and Torres Strait Islander peoples or First Nations peoples. So let's do it. The first part in the syllabus says, what does the data tell us? Okay, so what are the actual statistics and trends related to First Nations peoples? Okay, so there is an 8.8 year and an 8.1 year gap in life expectancy for males and females respectively. Okay, now that their age life expectancy is increasing, which is good, but it's increasing at the same rate as the rest of all Australians, so that actual gap isn't really closing. So, you know, that's sad. There is a 2.3 times higher burden of all disease. Okay, so if you you think of the causes of morbidity, all right, and whatever those causes are, there is a 2.3 higher chance that if you are a First Nations person, you will get one of those diseases. Okay, or another way to think about this is that for every non-First Nations Australian, there are 2.3 First Nations Australians that have the same condition. Okay, and obviously, because if you think about this, First Nations people, there are significantly less First Nations people in Australia than the other Australians. Then that's a lot of people. Okay. Now this is thankfully trending downwards. It is trending downwards slowly, but it is trending downwards. Okay, and it's mainly driven by improvements in major causes of disease like cardiovascular disease, for example. Now, suicide rates are a problem. So suicide rates are still very, very high for First Nations peoples. First Nations peoples have a 2.9 times higher rate or a 2.6 higher rate for First Nations men and females respectively from dying from suicide, okay, which is huge. That's a huge number, okay? Another concerning huge number is that suicide also accounts for 1 in 5 First Nations youth deaths. So between the ages of 0 and 24, just over 20%. It's almost 21% of all people, First Nations peoples between the ages of 0 and 24 dying from suicide, okay? That's horrible, horrible statistic. And you can see why the government is doing what it can to close the gap. And we'll definitely be talking about that later in this video, okay? Because these rates, just because you are a First Nations person, doesn't biologically mean that you should be suffering from all these things, but it's happening, okay? And we need to do something about it. High rates of low birth weight babies. So in other words, babies that are born are underweight. And just for some demographics, so 41% are now living in major cities. That's actually trending upwards, if you wanted to put a trend. It doesn't necessarily mean that's a good thing, but some of these issues are due to a proportion of First Nations people living in remote and very remote communities, and therefore they can't access healthcare and et cetera, et cetera. So this is trending upwards. More Aboriginal and Torres Strait Islander peoples living in major cities. 15% of them are still living in remote and very remote communities, and the other, 44%, quick math, are in between somewhere. Like where we live, because we're not in a major city, but we're not in certainly remote communities either. So that's just some data. Okay, so I could give you so much information on this stuff, but the video would be an hour and a half long. So I've sort of just tried to cherry pick some ideas. But if you want more details, go check out the textbook or look it up, because there's heaps of resources, particularly on the AIHW website, which is amazing for all this stuff, okay? So how did the determinants interact? So remember, we've got our determinants of health, and they can all interplay to a degree explain why people suffer from X, Y, Z, okay? So let's look at socio-cultural and environmental to start off with. So Remember, I mentioned it in the first video. So there's still this systemic racism and discrimination, and remember we talked about like indirect discrimination as well. That happens with First Nations peoples. Okay, so because of this, and to a degree, a lot of it is changing, but there is still the stigma about it. And because there's the stigma about it, then it creates this barrier where people don't try new things. So, for example, okay, hang on, let me read this out and then I'll give you the example. So, systemic racism and discrimination lowers the likelihood of seeking medical help, creating a barrier to healthcare. Geographic location compounds this by limiting the access altogether. So back to my example, okay? Let's say you live, you're a First Nations family and you live remotely, okay? You have a job and whatever, that's all fine. But you start, let's say you're a smoker, which is common, and let's say you start developing this like cough and you're worried about it. You go to the local doctor, it's only one doctor in the town, and they're heavily racist, okay? Let's say this happened 20 years ago, all right? Heavily racist, and they're judgmental, and they make you feel bad, and it's your own fault, and they're not going to help you. Well, they will help you, but the way that the message and the health message is delivered makes that First Nations person feel extremely uncomfortable, and they're not going to listen to their advice because they're just being racist. Let's just call it what it is, okay? So then let's move forward 10 years. You've now got like severely onset like lung cancer, but you're also bringing your kids up, and your kids are now teenagers, and let's say one of your kids has started smoking, or just at parties or whatever on the weekends, and then they start to develop signs that maybe their respiratory tract isn't well, because remember with COPD is still pretty high. And you want them to go to the doctor, but you don't. You don't encourage them to go to the doctor because you went to the doctor for the same problem, and that you were judged, and that doctor is a racist, and they're a terrible person, which is horrible. Okay, like I know this all sounds like make believe, but it happens. It is happen, and it still happens. Okay, I'm talking hindsight, but this is the system, unfortunately. So then let's fast forward another 15 years to current day. Okay, the original person is now like a grandfather. And they've passed away in the meantime from lung cancer or something. The person who was smoking is now an adult, and now they've got kids. Okay. Now, let's say the doctor in the meantime has obviously retired and whatever, and they've got a new doctor in town. But because of the experience that we had, or the previous generations had with said racist doctor, it doesn't foster that welcoming aspect. So this systemic racism and discrimination as a barrier for healthcare is ongoing, even though things are changing. Okay, this is why it's going to take, and I mentioned it in the first video, a long time, a long time, okay? Which sucks. Anyway, moving on. Socioeconomic. Lower average levels of education completion. So like think of like year 10, year 12, you could get like Cert 3 and 4s, you could get bachelor degrees, you get master's degrees. So they're what we're talking about with levels of education. So there are lower average levels of education completed by First Nations people, which therefore leads to lower employment opportunities and therefore lower income. Now so don't mishear me. There are people that do not have bachelor degrees from university that make heaps of money, okay? Good for them, all right? Or there are plenty of trades, actually the majority of trades people make more money than I do, okay? On less education than what I have, okay? But that's not what we're saying here, okay? Generally, we're saying statistically, there are definitely lower average levels of total attainment, and it does limit employment opportunities, all right? So once again, if you go back to that first example, you live in a remote town, there's not that many trades like kicking around. Even here in Newcastle, there's heaps of trades, but they're all full. Like no one's taking on apprentices because they're all, everybody's busy. So anyway, so therefore, lower education, leads to lower employment rates. Lower employment rates can lead to lower income. Lower income means you have less money to spend on things, so therefore lowers your level of healthcare, etc., etc. Okay, it's a snowball effect. So for example, let's say I just made this up. You have low income, which is a socioeconomic determinant, limits housing options, often leading to overcrowding and poor living conditions. So multiple people will all live together in a very tiny spot. So you may actually be sleeping on a floor in a room as opposed to a bed and all that kind of stuff. And that's an environmental determinant thing, which therefore accelerates the spread of disease, and it can exacerbate chronic stress and poor mental health, because if you're all stuck together, then that can lower mental health, which is now linked to socio-cultural because of your living conditions. And therefore we know from the first slide about what the data tells us that suicide is extremely high in First Nations people. So you can see how this can happen very easily. So that's just some information on determinants. All right, so what are some causes that are underpinning these inequities? All right, so if it's not a real biological reason, then what is it, okay? So and it's the same recurring theme here, all right? So colonization and dispossession. So the historical impact of European invasion, loss of land, loss of rights as people, okay, has deeply hurt connection to country, plus the ongoing psychological and emotional trauma of the stolen generations, all right? It's not just something that First Nations people forget, all right? It is entrenched, it is a deep memory, and as I keep repeating myself, it's going to take a long time to get over, all right? You can't just, get over it. It's not that simple, all right? It's not that simple because it only takes one discriminatory remark or one, racist comment or one just example of, you as a person being a lesser person, and all of a sudden all the feelings and emotions and the trauma comes back, all right, in an instant, all right? So yeah, it is going to take a long time. Systemic racism, I've already touched on that before, but there are entrenched biases in healthcare, in education, in the justice system with police, etc., that marginalise First Nations people. So instead of that viewpoint where everyone is an individual and everyone deserves, individual care and individual reasoning, there is still quite a significant number of organisations and, people within organisations that just put them in groups and put people in boxes. And it's like, okay, well, you are a First Nations person, so this is what we expect of you. And that's not true, and that's not fair, all right? Because I sure as hell know there are a lot of successful and very impressive First Nations people that are a lot more successful and impressive than non-First Nations people too. So just because you're a First Nations person doesn't necessarily mean that this is your box and that's the one you go in. Anyway, getting off topic again. Loss of culture and language. So we've got forced suppression of cultural knowledge that traditionally supported holistic well-being, all right? So you've got to remember, before European colonization, First Nations people looked after themselves, okay? We were fine, no dramas, all right? It was actually the colonization that you look at the top causes of, mortality and morbidity. Those things weren't around for First Nations people before, Australia became what it is today. So the people know how to look after themselves, and therefore that needs to be trusted, okay, and encouraged. But a lot of that was lost when the whole stolen generations drama unfolded over all those many years. So there's some causes that underpin the inequities that we talked about before. So in this last little bit, what can be done to improve the status of First Nations people in Australia? And once again, could have given you way more information than what you needed. I figured 4 points is enough. So we've got our ACCHOs, all right? So I spoke about them earlier, and we did touch on ACCHOs back in prelim. So expanding services like Purple House and the Purple Truck, so there's some explicit examples for you to use in your responses, that support and deliver culturally sensitive and appropriate healthcare. Okay, so this is like healthcare without judgment. The Purple Truck is actually portable, obviously mobile, so it can go, to the remote or very remote areas as well. And it's all led by people in community and delivered by people in community, and therefore it is holistically appropriate care, which is excellent. So we've got Closing the Gap and the Coalition of Peaks, all right? So Closing the Gap you've probably heard about. They're targets that the government's set to basically close that gap between morbidity, mortality, statistics, etc., between First Nations people and other Australians. And the Coalition of Peaks was, I think, founded and then implemented about 5 years ago now. And so the Coalition of Peaks is a body of community representatives. So now they themselves are driving and weighing in on how Closing the Gap should be delivered, as opposed to just the government delivering it how the government thinks it should be done. So that connection with community, this part here, is super important for First Nations peoples to get traction and success. Okay, so continued implementation of Closing the Gap policies in correspondence with Coalition Peaks to address concerns driven by the community. You'll notice most of these have some link to community, and that's what makes it successful. Because of that, you go back, one slide. Because of that systemic racism and the history there is a lot of distrust between Aboriginal and Torres Strait Islander peoples living in Australia and the government, okay? And it's going to take a long time for that trust to build back up or forget. Well, I don't think you'll ever forget what has happened, but at least take time for the trust to build up. But the best way to get it done is by getting it done by First Nations people for First Nations peoples, which is why the Coalition of Peaks is now chiming in with Closing the Gap policies. Thirdly, we've got culturally safe mainstream care, because we shouldn't, as a group, First Nations people shouldn't just be relying on ACCHOs, Purple House, Purple Truck, etc. Should be able to go to any doctor, any hospital, and get the same level of care that anyone else would, all right? So something the government does is now mandate cultural sensitivity and awareness training for all government employees. So as a Department of Education teacher, I have to go through this. My wife, who actually works in health, she has to go through this, and we've got to do this annually. And I do believe that it is now mandated across all government sectors, and if it's not, it is slowly being implemented. There's also been legislation against racism that's been implemented over the time. So if there is behaviours of racism, then you can actually, go to the police regarding that. I will say about the cultural sensitivity training. It's gotten a lot better over the years. It used to be so dry and it didn't mean anything. It was just words on a page. But now it's actually really good. And I'll tell you actually who has a really good one is the University of Newcastle, believe it or not. So when you enroll as a student there, you have to do culturally sensitive awareness training, which is tailored towards First Nations peoples, and it's excellent. And I don't think you guys can actually access it as non-students of the University of Newcastle, but if anyone from the University of Newcastle is watching this, I like the training module that students there have to do is really good. Finally, we've got our addressing social determinants, all right? So investing in community-led housing infrastructure, improving access to quality education, and supporting economic empowerment through, higher levels of education, better job opportunities, etc. Okay, so there is some things that the government can just throw some money at and it will actually be meaningful, providing, once again, it is community-led. So if you ever, when you're looking at and addressing any questions about Aboriginal and Torres Strait Islanders or First Nations peoples in your HSC tests, if it's going to be successful, it's got to be led by community. It's got to be driven by community. It's got to be deeply entrenched in community and then delivered, okay? It can't just be from some Joe Bob from, Parliament who comes along and delivers something. No one cares about that, okay? Yeah. So that'll wrap up my, as short as I could make it, video on groups experiencing health inequities being Aboriginal and Torres Strait Islanders or First Nations peoples. Thanks.